Welcome to our virtual ribbon cutting for the Stafford Hospital Cardiac Cath Lab. We're very excited to be able to provide this service to our community. In February of 2009, Stafford Hospital made a commitment to our community. This commitment was to provide the best care we could. With this ribbon cutting, we're bringing this new cardiac cath lab to our community. I'd like to introduce now Susan Spears, President and CEO of the Fredericksburg Regional Chamber of Commerce.
All right, thank you, Kathy, so much. It's hard to believe it's been about 11 years since I remember being here when we first opened the hospital, and it was such an exciting day for the Fredericksburg region. And we're just thrilled to be here now, even in the midst of this time in our country and our world where we have a worldwide pandemic. And I'm talking to you wearing a mask. It's the way of the world, and yet business goes forward. And the Fredericksburg region is delighted to see the Stafford Hospital moving forward with the expansion of this cardiac cath lab that's just going to make such a difference for so many lives here in the Fredericksburg region, and perhaps even beyond as people come in for the specialized services that they can get here. Hospitals are business. They are the backbone of the business community. They are all about the community. And at a time like this, it's more important than ever to recognize the accomplishments and the forward thinking of our hospitals. The Chamber of Commerce is delighted to support you today and wish you all the best as you move forward with the new cardiac cath lab. Thank you.
Hello, my name is Crystal Vanuch, and I am the chairman of the Stafford County Board of Supervisors, and I also represent the Rock Hill District. Today, I bring congratulations and best wishes from the Board of Supervisors to Mary Washington Healthcare and to Stafford Hospital on opening the new cardiac catheterization room at Stafford Hospital. This move brings more opportunities for treatment within Stafford County. Cardiac catheterization gives doctors information to make life-saving decisions quickly, and having this service in our community will improve the outlook for Stafford heart patients. I want to express our appreciation for Stafford Hospital making multiple treatments available to the community, meaning people have less distance to travel to visit loved ones and for treatment. Since Stafford Hospital opened, they have been an excellent community partner for Stafford, and openings like these reinforce the hospital's continued dedication to our residents' health. Again, I want to congratulate you and thank you. Stafford County stands by to do whatever we can to help ensure Stafford Hospital is successful in its mission to help all of our residents. Thank you and have a great day.
Hello, I'm Rick Cobert. I'm the Economic Development Manager in Stafford County Department of Economic Development and Tourism. It's my privilege to speak to you today to thank Stafford Hospital for their new expansion and investment in a catheterization lab in their facility. Stafford Hospital has been a great growth pattern for us in healthcare and is actually the catalyst for our target services in healthcare throughout the county. As the hospital grows, other companies are drawn to the area to work with them to expand from therapists to rehabs to other facilities for medical care. Your location in the Stafford County community is excellent. You're in the center of our community. Around you are many of the people you serve: the government center, the courthouse, the hospital, of course, and next to the hospital, a small center from Germanna Community College, now educating students, which may become a full Stafford campus in the near future. Across the street will be a new core that we have nicknamed Downtown Stafford. All of this comes together with this new downtown Stafford smart city as the core. So we think the next 10, 20, and 30 years is going to be incredible here in Stafford County, and you are a part of it.
Good afternoon. Ever since opening its doors in 2009, Stafford Hospital has served the growing medical needs in the community. In 2012, cardiac services at Stafford took another consequential step when it started performing coronary and peripheral interventions. Today, I'm happy to state that the Stafford Hospital marks another milestone on its progression of its cardiac service line as we open this beautiful state-of-the-art cardiac catheterization lab. This dedicated cath lab will allow us to perform a wide array of diagnostic therapeutic cardiovascular procedures. However, I think that this achievement represents something more and something more significant. I think it is clear evidence that the health system's commitment to further advance its mission to fully address the cardiovascular needs of this growing community. This initiative, as well as the collaboration with Oracle Heart and Vascular, demonstrates the resolve of the Mary Washington Medical Group to provide the highest quality of care for our patients at Stafford. I'm grateful for the administrative team for their foresight. I'm looking forward to be working with our clinical colleagues as well as our community cardiologist to create a robust and distinguished cardiovascular service line here at Stafford Hospital. Thank you.
Hi, I'm Victoria Axford. I'm the nurse manager at Stafford Hospital Cardiac Cath Lab. We're here to cut the ribbon for the new expansion of the cath lab. 1, 2, 3.
Thank you for attending our virtual ribbon cutting. Now let's take a closer look at our cardiac cath lab.
Cardiovascular disease remains one of the #1 causes of mortality and morbidity in the country, and I think Mary Washington has recognized that and has decided to invest $2.5 million into this new cardiac catheterization lab.
We were able to open a care lab years ago, but we only had one room, so we were trying to be efficient as possible through this one room, doing interventional radiology procedures as well as cath lab procedures. And we just identified it was just not enough. We wanted to be able to get patients in and out quickly and efficiently, of course, with the best patient care possible.
We have patients waiting to get into the cath lab. We have several procedures and physicians that are doing procedures over there, so to be able to accommodate everybody, it's been very challenging. So opening this new lab, we're able to get people in, get patients in so that they could get those procedures that they need done, get the treatment they need, and for better outcomes for our patients.
Cardiac services here at Stafford has extended into both invasive and non-invasive modalities. From the non-invasive, I mean, we offer pretty much a comprehensive array of testing, for whether it's from stress testing to echocardiography to carotid Dopplers to peripheral testing. The invasive branch of the testing and procedural branch is mostly done at the cardiac catheterization lab or the interventional lab. And these include diagnostic right and left heart catheterization, diagnostic peripheral angiograms, but then furthermore it can be extended to deliver some therapeutic options, including stenting and angioplasty. And it really adds a significant advantage to both the community and mutually the health system to really take care of our own.
We built this hospital for this community. We want it to be for Stafford and surrounding areas, of course, so it does mean a big deal if a patient comes to us for their care. We want to be able to keep them here. We don't want them to have to be worried about how far they have to be away from their loved ones.
I'm a managing partner and the president of a private cardiology practice, Oracle Heart and Vascular. We entered into a partnership, a collaboration with Mary Washington Health System and Mary Washington Medical Group to really support and bolster their services locally here. We have a clinic that's on campus where we essentially have a physician there every day to see patients. We're taking care of our cardiac patients in the hospital, and there's always a presence. And I think really what we've formed is a consistent presence.
We are growing. We're able to give more to our community. For those patients that do come in a little bit sicker than others, we're able to give that care that they need here. And increasing our service line over the years, we have been able to do that as well. So this is just a continuation of our growth and to better help our community.
Sometimes the secret to success is just to show up. And I think here now, patients can show up, and there's a cardiologist here that will take care of you. You'll have easy access. You'll be able to schedule appointments as soon as you need. You'll have availability to get testing done. And not only just availability and access, but you're going to have excellent standard of care. And I have complete confidence in my group. I have complete confidence in our staff here at both the hospital and the clinic to take care of you. And we're here.